5 kilometres from the border town of Teknaf, on the southeast tip of Bangladesh, is a refugee settlement named Tal. Tal camp sits precariously on a tiny strip of land. It's built on a mangrove swamp, sandwiched between a busy highway and a tidal river. The road is a constant hazard, with weekly road traffic accidents. The river floods the tiny dwellings daily. Surviving in these most squalid of conditions are 10,000 refugees. They are ethnic Rohingya, who have fled persecution and gross human rights violations in their homeland of neighbouring Myanmar. Most have been living in this cramped environment since the camp was formed over 4 years ago. Médecins Sans Frontières has been working with Rohingya refugees in Bangladesh since their first major influx in 1992. Shannon is the Médecins Sans Frontières project coordinator in the Teknaf project, which focuses on providing healthcare services to Tal camp. Here she tells us about MSF activities within the camp.
MSF came into the camps about 2 years ago now, and we have been the only NGO working in Tal camp, and so because of that we've become very important to the people. We provide a feeding center for malnourished children. We provide mental health counselling services through our mental health program. And then outpatient services through our small clinic. In that clinic we have ANC, PNC for pregnant women, we have hygiene promotion in Tal, and we have basic health care with 4 doctors and nurses.
Here's Kolya, the medical doctor in MSF's Teknaf project.
The most common problems that we see is diarrhea, skin infections, and respiratory tract infections. We see them also in the Bangladeshi population, but they're much more common amongst the refugees. It's because they live in much poorer sanitary conditions. They live in very crowded little huts, smoke-filled when they cook. The rainwater is running through the camp, the river's coming up, flooding parts of the camp, which makes up for a lot of diarrhea. Of course, the children suffer most of it. They have the least resistance. Malnutrition is widespread.
Frido is the MSF head of mission in Bangladesh.
This group of 10,000 people have been literally kicked up and about for the last 15, 16 years after they fled Myanmar in the early 90s. Forcefully repatriated, fleeing again, moving from one home to another.
Aside from providing medical care, MSF has been advocating for the needs of the Tal population. Gabby, the MSF medical coordinator in Bangladesh, explains.
Well, right from the very beginning, our main advocacy objective was to convince the government, to put it nicely, to make these people's life a little bit better. So we advocate for people to be moved from the people from Tal, I'm talking about, from the place where they are, in a better place. And yeah, looks like the advocacy produced some results. And the government decided to make available this piece of land next to Lada Bazaar, and yeah, European Union and UNICEF and the other NGOs which are in this partnership involved in movement of Tal, they are going to make it possible in the near future.
Médecins Sans Frontières has begun its handover to these partners. Here's Frido again explaining how MSF is advising them on their approach to service provision.
MSF has always offered its services regardless of whoever came to our clinics, and we're very strongly advising all of our partners to do exactly the same thing. One of the things which we're doing right now, we have quite significant investments in water sanitation in Tal camp and also in the new location, but at the same time we're also investing in water and sanitation facilities and infrastructure around in the host community, so that the local school also has potable water, so that the local mosque also has clean latrines, so that the community centers of the local towns also have proper water.
Whilst Médecins Sans Frontières welcomes the move to the new camp location, there are still a number of concerns. MSF is advocating the need to address these issues promptly. Frido continues.
But in the short run, I think one of our main concerns is the immediate food needs. Call it 6 months, call it 12 months after the move, and particularly the vulnerable groups, they will need food support in terms of direct food aid. The whole protection issue, the security issues around the new location are very much of a concern to us, based on what people have said to us. It's the education, it's the livelihoods, the food security, the longer term possibilities for employment and economy, basically. And that's where the other organizations come in, because that's really the developmental side of things. That's really the long-term self-reliance, sustainability that other actors are very good at. So I think as MSF we've kicked this off. We've made sure that the first step is now taken, but there's many more steps to be taken, and those will have to be done by others.
In addition to the Teknaf project, MSF also has a nutrition intervention in the Chittagong Hill Tracts of southeast Bangladesh. MSF has been working in Bangladesh since 1985.